Muscles of mastication. The four muscles of mastication are masseter, temporalis, lateral pterygoid, and medial pterygoid. All four muscles take origin from the base of the skull and get inserted into the ramus of the mandible. Action of the four muscles of mastication is elevation and depression of mandible, protrusion and retrusion of mandible, and side-to-side movements. Innervation is by the branches of mandibular nerve. Masseter is a quadrilateral shaped muscle that has three groups of fibers, the superficial, middle, and deep. Origin of masseter is from the zygomatic arch and insertion is into the ramus of the mandible. Action of masseter is to elevate the mandible and to protrude it. Innervation is by the mesenteric nerve, which is a branch of mandibular nerve. Temporalis is a fan-shaped muscle that takes origin from the temporal fossa and the temporal fascia. Insertion is into the coronoid process of mandible and the anterior border of the ramus of the mandible. Action of the muscle is elevation of the mandible and its retraction. Innervation is by the deep temporal nerves, which are the branches of mandibular nerve. Do like this video and subscribe to the channel for more videos on anatomy. Lateral pterygoid is a conical or a triangular shaped muscle that has two heads, the upper head and the lower head. The upper head takes origin from the infratemporal surface and the infratemporal crest of the greater wing of sphenoid, and the lower head takes origin from the lateral surface of the lateral pterygoid plate. The two heads unite and get inserted into the pterygoid fovea and into the capsule of the temporomandibular joint as well as the articular disc. The action of lateral pterygoid muscle is to depress the mandible to open the mouth, which is brought about by its lower head. The upper head helps in protrusion of mandible. The muscle also helps in bringing about side-to-side movements of the jaw. The innervation of lateral pterygoid muscle is by the lateral pterygoid branch of the anterior trunk of mandibular nerve. Medial pterygoid is a quadrangular shaped muscle. It has two heads, superficial and deep. Superficial takes origin from the tuberosity of maxilla. Deep takes origin from the medial surface of the lateral pterygoid plate. Insertion of the muscle is into a rough triangular area on the medial surface of the ramus of the mandible, close to its angle. Action of medial pterygoid muscle is to elevate the mandible, to protrude it forwards, and to bring about side-to-side movements. Nerve supply of medial pterygoid muscle is nerve to medial pterygoid, which is a branch of main trunk of mandibular nerve. Summarizing the functions of muscles of mastication, elevation of mandible is brought about by masseter, temporalis, and medial pterygoid. Depression is brought about by lateral pterygoid muscle. Protrusion or forward movements of mandible is brought about by the lateral pterygoid muscle, the medial pterygoid muscle, and the superficial fibers of masseter. Retrusion or backward movement of mandible is brought about by the posterior fibers of temporalis muscle and the deep fibers of masseter. Side-to-side movement is brought about by the lateral pterygoid and the medial pterygoid muscles. Students can click on the link for complete chapter of infratemporal fossa that will include the topics muscles of mastication in detail, temporomandibular joint, mandibular nerve, maxillary artery, otic ganglion, and pterygoid plexus of veins.